site already. And I would, as an environmental health scientist and as someone who has worked in the public health and environmental space, I would argue that this demographic shift has really changed the kinds of conversations that we are having in the field of environmental policy making, particularly here in California. And the influence of environmental justice advocates and impacted communities in having a seat at the table. And it was making a lot of inroads at the federal level. We have a little hiatus right now, so I'm going to be focusing a lot on what's going on in California. So a bit of history for those of you who may not be familiar with this movement. People often point to an incident in the late 70s and early 80s in Warren County, North Carolina, predominantly African American and quite poor. And what happened was in the late 70s, a waste hauler, which was kind of a fly-by-night operation, was supposed to get tanks full of PCBs and dump them in a repository where you were supposed to dump those things. And because it was a fly-by-night operation, it actually ended up going down country roads and letting the stuff kind of leak out the back of the tank. And so what happened was you had PCB-contaminated roadways, literally tens of thousands of tons of PCB-laden soil that then now created a huge problem. And US EPA had to get involved, and the North Carolina Department of Environmental Protection had to get involved to clean up this mess. And one of the decisions the state had to make was where we're going to put the soil. And the decision was to locate the dump in Warren County, North Carolina. Needless to say, people who lived there were not happy with that decision. And the other thing was that regulators who made that decision hadn't kind of realized that many residents of Warren County had a strong history of organizing and advocacy in the civil rights movement. And so to resist the placement of this dump, they employed similar tactics of nonviolent civil disobedience to try and prevent the dump from happening. When the dump was built, they literally laid down in front of these trucks to try and prevent these trucks coming in to dump the soil. Ultimately, they lost that battle, and the dump was placed there. And it became a long, decades-long battle to finally close it down and then remediate it. And that's kind of a whole nother conversation. But the point I want to make about this story is that even though this battle was lost, it did launch and put environmental, the notion and the concepts of environmental justice and environmental racism on the map. Organizers were very effective. They got the Congressional Black Caucus to come and lay down alongside them. 500 people got arrested. It got a lot of media attention. And so for the first time, people were talking about this issue of environmental equity, environmental justice, and environmental racism in ways that hadn't been in sort of the mainstream environmental space ever. Now, if you look back historically, if you think about the fight against DDT and the role of the United Farm Workers in getting rid of DDT use in agriculture, et cetera, there are a lot of prior incidents of environmental justice organizing, et cetera. But this was really the incident that kind of put it in the map and really kind of literally changed the face of environmentalism, and also launched a whole new field of inquiry and research that was very interdisciplinary in the social sciences, in the field of public health, geography, et cetera, where people were really trying to understand the extent to which communities of color and the poor bore the brunt of exposures to environmental hazards, trying to understand what the drivers of that are. And in my field in environmental health science, trying to understand what the health implications of that are and what we can do about it. So, one of the major funders in my field in public health is the National Institutes of Health, and specifically within that, the National Institutes of Environmental Health Sciences, which funds most of the major environmental health work for those of us in the field. And in the 90s, the National Institutes of Environmental Health Sciences got its first African-American director, Kenneth Olden, who decided to create financial incentives for scientists like myself to do more collaboration with environmental health science, collaboration with communities that were affected by environmental hazards. Going to literally put money on the table for us to do more community engaged research in our work. And so at that time, when you wanted to get a huge grant to create the center of this, that, and the other thing to study your environmental health problem, you needed to have what was called a community engagement core as part of that center and build it up and have a legitimate and genuine partnership with community organizations in your projects. And so these types of mechanisms have been funded in many RFAs in federal grant making for quite some time now, a few decades. And I would argue that this kind of history now of collaboration, many of these community scientific collaborations have been sustained for quite some time because of this financial incentive. And this has not only increased community capacity to engage in scientific work, but it has also shifted the way scientists like myself think and understand disease causation, particularly by environmental hazards. And what I mean by that very specifically is researchers, as well as the regulatory community, regulatory scientists, people who are like at US EPA or CalEPA, are being pushed by environmental justice advocates to address what they, and now we call cumulative impacts, which is a term now that people use a lot, and I want to kind of give you an idea of what that actually means. Basically, it's forcing us to really think about the ways in which structural drivers of social inequality are linked to environmental degradation itself, whether that's talking about our air, our water quality, food safety, other things, and potentially is linked to the persistence of health disparities in terms of chronic disease by race and class lines. And specifically, we need to do a better job as scientists of thinking about the fact that communities are exposed to multiple hazards in the different environments in which they move about every day. Regulation tends to focus on one pollutant at a time, one facility. We do a lot of risk assessment with a lot of data looking at one type of thing. And communities that are impacted by these types of things point out, rightly so, that maybe that's not very accurate in terms of what people, the broad suite of things that people are exposed to in terms of hazards. So that's one element of cumulative impacts, the fact that we need to do a better job of taking into account multiple hazards. The second piece is, how do we better incorporate the fact that certain communities are more vulnerable to the toxic effects of environmental hazards or pollutants due to their exposures to chronic social stressors, okay? By that I mean poverty, chronic poverty, malnutrition, chronic and everyday experiences with discrimination that creates stress and degrade the immune system and can lead to underlying chronic health problems that then increase your vulnerability to the toxic effects of pollutants. Many people have written papers on this. And conceptually, this is an example of what I like to call the triple jeopardy, or thinking about the political economy of riskscapes. In public health, we talk a lot about health risks, individual level health risks, and how we can modify risk factors to protect public health. So when we're thinking about cumulative impacts, we really need to do a better job of thinking about the social context. What are some of the fundamental drivers that create asymmetries in communities' political power to protect themselves from environmental hazards? How does that relate to the environmental intensity of consumption and potentially the erosion of social cohesion and the collective willingness and the political will to invest in environmental regulation and protecting everybody? So social context, thinking about racial residential segregation, which is something I'm going to talk a lot about today as an example. Discriminatory policies and regulation that disproportionately impact the poor and communities of color. Income and wealth inequality, okay? And then that plays out demographically, disproportionately impacting certain groups more than others. And it also can be very place-based. And then the elements of cumulative impacts are disparities in exposures to hazards, whether that's in our work, whether that's the air we breathe, the fact that we live near major transportation corridors that expose us to pollution, poor drinking water quality. And then how do we take into account both what I call extrinsic factors, or the social vulnerability factors, things like poverty, food insecurity, psychosocial stressors, access to healthcare. These are things that are not underlying biological factors, but that are social factors that create community vulnerability to the toxic effects of pollutants. And then, yes, we need to take into account the biological susceptibility factors, the intrinsic factors that can make us more vulnerable. For example, children are much more vulnerable to exposures to certain kinds of toxics, the elderly, if you have an underlying disease condition, malnutrition, and genetics and sex differences, okay? All of these things can come together and interact or create additive effects, which then can drive what we see as the persistence of racial and class disparities in disease and death. So that's kind of the nerdy schematic of what I mean when I'm talking about cumulative impacts. Communities, you know, like to say that a picture says 1,000 words. So this is a visual of what cumulative impacts could mean for a particular community. This is a community known as Liberty and Atchison Village. It's actually on the National Register of Historic Places. It was housing that was built to support workers who were coming to Richmond to work in the shipyards, and the Kaiser shipyards in particular. It's actually quite a lovely place. And they are along the fence line of the largest oil refinery west of the Mississippi, the Chevron Oil Refinery. This is a flyover taken of this area. In addition, this community is next to two major freeway corridors, 880 and 580, and there are many other sources of air quality problems and noise, et cetera, the ports, other chemical companies, the rail yards, et cetera. So this is a visual example of cumulative impacts, multiple hazards. Here's another example for those of you from Southern California. This is the 710 freeway corridor, and this is the community that lives nearby. So these are visuals of cumulative impacts to give some context to the schematic that I just showed you. So what does this have to do with data? Well, I think the question is, what are some great strategies to really get into and understand the nexus, the connection between equity and environmental quality? And I am an epidemiologist and environmental health scientist by training. So we were often taught that the best data is the kind that you collect yourself, primary data collection. And I still do that in a lot of my work. But to ask some of these more macro questions, primary data collection is very place-based specific. Very often you have a lack of statistical power to really stratify your data and to look at differences in relationships across, for example, different population groups. Very often you want a big geographic scope, like I like to look at the whole country, very often metropolitan areas across the country. And primary data collection is very difficult to get that kind of access to that data in terms of time and money required. And then the fourth one is something that I like to call the need to do data judo, which is very often existing data, administrative data sets from major agencies can situate you well to do a study where if you see an effect or you're getting a signal, you're using an agency's data to make it see something that it wasn't seeing before, or you're asking a question of an agency's data that it has not asked itself, and you're showing them something that maybe they need to do something about. There's something very powerful about using an agency's own data to get it to see something that it had not looked at before. So I call that data judo. And so large secondary administrative data sets can really kind of move us forward in a way that I think sometimes primary data cannot. I still think primary data is awesome, but sometimes these secondary data sets are better for asking these big picture questions. So what are some of the things that we have tried to look at? And I'm just going to give you some examples here. I'm very interested, and my lab is looking at indicators of social inequality. We're interested both in the ways in which communities of color and the poor may or may not bear a disproportionate burden of certain exposures to certain environmental hazards. But the second question I'm also interested in is, to what extent does social inequality, measured by racial residential segregation, for example, degrade environmental quality overall for everybody? Okay, because that is also an important question. So here is a map of the United States. And this is looking at racial residential segregation in over 300 metropolitan areas of the country. This is a measure that is commonly used in the sociological and demography literature. It's called the Multigroup Dissimilarity Index. And basically it measures the physical separation by census tract of different racial and ethnic groups within each metropolitan area from each other, okay? And the measure basically says what proportion of people would have to get up and move within a metropolitan area in order to achieve an even distribution of the people who live there, okay? And what the beauty of this measure and why it's used so much is that it is composition independent. It allows you to compare a city like Detroit with a city like Portland, Oregon, okay? Because it's not completely reliant on the underlying makeup of the city. So areas in red are considered, or deep red, are considered to be hyper-segregated, meaning that about over 60% of people would have to get up and move. The yellow areas are moderately segregated. Less than 40% of people would have to get up and move. So you can see in this map that the hyper-segregated areas are in the Midwest and the Northeast and some pockets in the South. Less segregated areas are in the western and southwestern part of the United States. So the first study I did a long time ago was taking advantage of a data set available through the U.S. Environmental Protection Agency known as the National Air Toxics Assessment. It's very difficult to get very granular measured data on a national scale. And so EPA, until recently, was generating some very excellent model data using a series of inventories and then checking it with data monitors to sort of assess the extent to which their models were over or underestimating ambient concentrations. And so this model looks at ambient concentrations of hazardous air pollutants which are regulated under the Clean Air Act and which are categorized by US EPA as known, probable, or possible carcinogens, okay? And we can look at them all together and toxicity weight them by their level of carcinogenicity, which is what we have done here. So on this x-axis, this is looking at the estimated lifetime risk per million residents related to cancer risk, okay? So a cancer-related pollution burden here. It's a back-of-the-envelope calculation, kind of a toxicity-weighted estimate of pollution burden to multiple ambient carcinogens. And then each line here on this chart represents a racial or ethnic group as defined by the US Census. So the purple line are Latinos, and the green line are Asians, the red line are African Americans, the yellow line are American Indians and Alaska Natives, and the blue line are whites, okay? And then we stratified our data by cities that are low to moderately segregated, highly segregated, and extremely segregated, and then modeled taking into account a lot of other indicators that might explain the relationship between pollution burden, race, and segregation. And so what you see here, the take-home message are two things. One is that, not surprisingly, in more racially segregated cities, you see more disparities in pollution burdens to these carcinogens compared to less segregated cities. But the other thing that you see here is that as segregation increases, this is the white line, the white residents here. White residents are better off than communities of color in more segregated cities, but they are much worse off than whites who live in less segregated cities. And that goes for every other racial or ethnic group. So there is something about inequality that appears to be degrading environmental quality in more segregated cities. Here it's probably due to the fact that most of the air toxics come from mobile source emissions, which probably means that people who live in more segregated places have to drive more to access things like their jobs, basic services, et cetera, which degrades the air quality for everybody. And this segregation effect is not explained by poverty, okay? So you still see a racial disparity by poverty level, but you're not seeing that same dose-response relationship. The next thing we did was we wanted to look at this in terms of nighttime noise, okay? This is a big deal in the field of environmental health now. A growing body of evidence links exposure to nighttime noise to a series of chronic health effects and behavioral problems, particularly in kids, but also in adults, cardiovascular disease, hypertension, adverse birth outcomes, et cetera. So this is becoming an increasingly more studied area. And again, we were able to get access to a fantastic data source, which are these noise layers available through colleagues that have modeled noise levels across the country at a very granular level. And we, again, wanted to look at what is the relationship we're seeing between nighttime noise levels and racial disparities in exposures to the nighttime noise, as well as its relationship to segregation. So you can see kind of the hot spots of high levels of nighttime noise are, not surprisingly, in major metropolitan areas. And then within these metropolitan areas, there's a fair amount of variability in exposures. So here we look at, these are the noise patterns for, this is the noise levels for nighttime noise on the y-axis, okay? And then the x-axis here is the proportion of each racial or ethnic subgroup here, Asian, Black, Hispanic, and white, living in a block group, okay? And so what you can see is that, again, you see a very kind of similar pattern. Noise levels decrease significantly in block groups where the proportion of whites increases, okay? So noise levels are going down as the proportion of whites increases, and you see the opposite pattern for most of the other groups. Hispanic has a much wider spread, okay? But the other thing is every color here of the line represents a level of segregation, red being hyper-segregated, blue being less segregated. And so even within each one of these subgroups, you see a much stronger effect and much higher noise levels overall for everybody in places that are more segregated, okay? Finally, here's an example with heat islands, okay? This is another area of interest for those of us who are working on climate change issues. We're concerned about heat island risks in urban areas because during extreme weather events, the mean apparent temperature can be really a lot worse in places where you have very low levels of green space and tree canopy and very high land cover in terms of coverage of impervious surface, okay? So for example, even in the San Francisco Bay Area, on an extremely hot day, you could go to a place in East Oakland and then come back to our lovely tree-shaded Berkeley, and the change in temperature just in that same time frame can be exceeding 10 degrees, and that can make a huge difference during extreme weather event, particularly in a place like the Bay Area where we don't have air conditioning or anything like that to help us adapt on the short term. So just to give you a sense of demographics here, and in 4 major cities in California, the brown bars is the proportion of land cover in a census tract that is impervious surface, and the green bars are the proportion of land cover in census tracts that are tree canopy. And these numbers represent the proportion of people who self-identify as a person of color. So as the proportion of residents of color increases in each of these cities, you can see that the proportion of impervious surface increases and tree canopy decreases, i.e. there's more heat islands in more minority neighborhoods, and you can also see a very similar pattern for poverty. So by kind of looking at this within California, it made us curious as to what's going on across the country. And using satellite data that showed tree canopy coverage and impervious surface nationally, again, looking at this segregation pattern, and we were looking at the odds of living in a high heat island risk neighborhood relative to whites in the least segregated metropolitan areas, the same number of metropolitan areas that I've been showing you. So again, these are whites, these are African Americans, these are Asians, and these are Latinos. And we can see that within each strata of segregation, you still see higher heat island risk, particularly for, in this case, Latinos and Asians, but you still see also quite a level of stratification by level of segregation, okay? So again, more segregated cities in general have more high heat island risks for everybody. And in more segregated cities, you see more racial disparities in exposures to heat islands, okay? So there's something about inequality above and beyond that appears to degrade different indicators of environmental quality, whether we're talking about air quality, whether we're talking about noise, or whether we're talking about risks of heat islands. Okay, so those are kind of macro patterns, which are good and very suggestive and I think answer key questions. But what can we say at the individual level, and again, leveraging administrative data to ask these questions, doing these opportunistic studies that enable us to look on a grand scale bigger than we could just by collecting our primary data. And what does this mean in terms of observing the potential amplification of adverse effects at the individual level? So, one is that there's something about inequality that is degrading an individual level's capacity to be resilient against environmental hazards. There may be even, for example, when we see racial differences, there may be something about, not genetics, because I think that theory about genetic differences across races explaining health disparities has basically, hasn't been completely settled, but I would say the overwhelming consensus is it's not explained by genetics alone. So there's something about those stressors that create vulnerability, those socially mediated stressors. Maybe they affect coping behaviors and people's ability to react and respond. And then the other question is, how do we measure those stressors physiologically in the body? Can we get at biomarkers of chronic stress response? So one measure that we can use using administrative data is a measure called allostatic load, which is a measure of the body's cardiovascular, immune, and neuroendocrine weathering, okay? And beautifully, the Centers for Disease Control collects all the measures that go into an allostatic load score, which is a biomarker of chronic stress response, which I'll show you in a second. So the first example of social vulnerability is, again, we leveraged, in this case, California Department of Public Health birth certificate data. That is all publicly available data. You do have to go through an IRB to get individual level data in order to geocode it, which we were able to do, but it's a fairly straightforward process. We looked at over 10 years worth of data in relationship to people's air quality depending on where they were living in the state of California. We were interested in the extent to which exposures to high levels of particulate matter during pregnancy led to having lower birth weight babies, okay? So these are different kinds of particulate matter. This is PM10, which is the largest kind that's regulated under the Clean Air Act. PM2.5, which is the smaller kind, the one that we're most worried about because it penetrates the lungs more. And this is coarse PM, which comes from often non-combustion. It can come from dust and other kinds of things. So what we see here is anything below 0 after controlling for individual level factors related to the mother and other area level factors related to her neighborhood, we saw a decrease of around between 3 and 10 grams for particulate matter, size 10, and even stronger effects for PM2.5. But we saw big racial differences in effect, with the strongest effects among black mothers, okay? So this suggests that there's something that's disproportionately affects all mothers, but it's affecting black mothers even more, this exposure to air pollution and birth weight effects. And this is concerning because one of the big things that we're struggling with in public health is trying to understand, despite a lot of effort, why African American mothers are consistently having lower birth weight babies than their white counterparts. And this suggests maybe we should be looking at some environmental causes maybe that may partially explain that, in addition to other things that we have traditionally focused on, like prenatal care. This is another study, again, looking at, in this case, CDC data available from the Centers for Disease Control. And we wanted to ask a question of, what are the hypertension risks associated with lead exposure, predominantly from lead paint, among adults? Now, we all know that lead is bad for you. It's been studied ad nauseum, so it's a little bit embarrassing to look at this yet again. But the innovation here is we were able to distinguish between subjects in this survey that have high allostatic load, in other words, high biomarkers of chronic stress response in their blood work and other clinical tests, And what we see is the folks in red, this one on this side is systolic, and this is diastolic blood pressure. And we saw higher risks of high blood pressure associated with lead, particularly in the highest quartile of lead exposure, among people who had high biomarkers of chronic stress. Okay, so again, this gets at the vulnerability factor, or in this case, the biological susceptibility factor. So these are some examples of the ways in which we've tried to leverage large administrative data sets to ask some of these big picture questions that environmental justice advocates are really pushing us to get at. And that enables us to look at individual level factors in the participants in some of these surveys, but also get at some of the social indicators of the neighborhoods and the contextual factors of the cities that they live in. Okay, now what I've shown you today is very urban-centric. I think more work could be done in rural areas. So what are the implications of these? Well, one is when we see patterns from these large studies, then we can maybe even better design some of our primary data collection studies. Because we're starting to see that there's something about living in a highly unequal environment that may amplify the relationships between environmental hazard exposures and adverse health outcomes. In this case, a lot of what I've shown you is related to poor birth outcomes. And yet, science is just starting to play catch up to community wisdom on this issue in the view of environmental justice advocates. I get teased by a lot of my community collaborators who tell me that I get a lot of grants from the federal government to study things that everybody already knows, okay? But they understand the importance of generating evidence in order to make the case for policy change. But it can be challenging because sorting out the science can take a while. And yet regulatory science and environmental regulations don't take into account the possibility of cumulative hazards and socioeconomic inequality. So while the nerds like me are trying to figure it out and what's going on, communities don't necessarily want to wait for policy change. They feel like the evidence is out there to try and start acting now, because if environmental regulation is about protecting public health, okay, we should be trying to do that rather than doing the perfect epidemiological study that will take a few years to figure out. These administrative data sources can also be used to develop decision-making tools that help regulatory agencies advance their environmental justice goals and maybe better protect public health as the science begins to get sorted out. So I want to give you one example about community engagement in the development of a decision-making tool that we worked on that was funded by the California Air Resources Board in their effort to try and better harmonize their regulatory activities and also advance environmental justice efforts that they were increasingly being called upon to address. So the goal was to try and map and develop indicators of cumulative impact that are reflective of current research on environmental health and social determinants of health, so environmental health science literature and epidemiological literature. At the same time, because this tool was going to be used by regulatory decision makers and also people like policymakers in Sacramento were going to want to kick the tires and look under the hood, these indicators had to be transparent and understandable by a wide array of people who are going to be looking at it. And this mapping tool could be used for land use planning, thinking about investments, about where you want to do more regulatory activities, and community outreach and engagement in places where you might be seeing evidence of cumulative impact that should be better addressed by CalEVA and its various regulatory agencies. So we underwent a rather iterative process, because the thing is, when you develop these regulatory tools for decision making, and it's going to be used for public consumption, and it's going to be used to allocate resources, stakeholders have to trust it. They have to feel like they played a role in shaping it and giving you feedback along the way. So this effort was co-created with a lot of stakeholder inputs, a scientific review committee, regulatory scientists, decision makers, industry stakeholders, as well as community organizations had a lot to say about it. They provided feedback on a lot of the indicators and data inputs. It was an iterative process. That's a whole paper in itself, which I'm happy to share with you. And then at the end, which I'll refer to in the end, there was a lot of ground truthing of some of these mapping results. One of the criteria for this was that any data input that was put in here had to be available for free, be publicly available, and it had to be available statewide, okay? So after a lot of focus groups, a lot of thinking about what indicators people wanted and trying to reconcile that with what kind of quality data were available, we came up with 5 kind of bins, if you will, of cumulative impact. So the first bin incorporated any data that we had on community proximity to hazards and sensitive land uses. So any data that showed where large industrial sources or small area emitters like auto body paint shops or other things were located. The second one is about health and risk exposure. So any data that we had around exposure in media, so air quality, pesticide use, traffic, these kinds of things. The second one were all indicators of health and social vulnerability, drawing mostly from census and American Community Survey data, as well as state data sources related to community engagement capacity, et cetera. These last ones are related to climate change vulnerability. So whatever data that we had available to us in California, heat, and some of the things that I showed you related to heat islands, and then predictions of temperature change, social isolation, and we've just added a drinking water layer based on the availability of groundwater and community water system data. So here's an example of what some of these maps could look like in the Bay Area. And so this is the layer that's looking at proximity to multiple potentially hazardous facilities, just taking into account kind of their location. And then if you just look at the health, risk, and exposure indicators that are focused a lot on air quality, pesticides, traffic, the map is quite different. Social and health vulnerability indicators based a lot on census data that has a lot to do with the socio-demographics of the neighborhoods that we're looking at in the Bay Area. This is climate change vulnerability, which gets at heat island risks, predicted changes in temperature, social isolation indicators. This is drinking water quality. People kind of raise their eyebrows when they see this. Drinking water quality in the Bay Area is really great in metropolitan areas, but in a lot of rural areas where people are dependent on very small drinking water systems, they can get a pretty high score just because people are dependent on domestic wells that are not being tested. So this does not mean necessarily that everybody's got contaminated water, but we just don't know what's going on here. And then you can combine these scores together to get kind of a cumulative impact score, to get a sense of where you might want to be focusing efforts. And you want to be able to sort of look at it all together and then peel apart the layers as well. So after we developed those maps for the entire state of California, we spent a lot of time ground truthing them with community stakeholders in different regions of the state. We trained people on the use of GPS devices, air quality monitors, to be able to go and verify what the administrative data said was there, or if the administrative data indicated that the air quality was good or bad. We did some air quality monitoring to get a sense of what we're seeing in the data actually agrees with what's going on on the ground when people are going there. So we did this in San Joaquin Valley, Southern California, Northern California. Here's an example of one location where we did PM 2.5 monitoring at a location over a period of a few weeks. During the weekends, just in areas of concern. And we did this again in multiple places. So this ground truthing of the data enabled stakeholders to get a sense of where's the data really capturing things, and then if it's not, to really figure out why is that, what's it missing and why. And by giving people an opportunity to kind of look under the hood and kick the tires of you, if you will, about the data that goes into these screening tools, they begin to understand the value of doing this, even while they're understanding its limitations. And so, what's been the end result of this whole effort, which took a while? Well, California, we're very fortunate. We have a climate change law in this state, and one of the aspects of the climate change law is we have a cap and trade program where major greenhouse gas emitters have to now pay for something they used to be able to do for free, which is emit greenhouse gases. Now, cap Cap and trade is a very controversial policy tool. A lot of environmental justice advocates actually don't like it, and I'm happy to answer questions about that. But the reality is, it is creating a source of revenue for the state of California. And so after AB 32 was passed, and it was clear that cap and trade was going to be an essential policy tool to get industries to reduce greenhouse gases, subsequent legislation was introduced that required the identification of, required that 35% of the funds that were generated through cap and trade be invested in programs that benefited disadvantaged communities that were facing cumulative impacts, okay? So that's a huge deal. And now the question was, how are you going to identify those communities that are disproportionately impacted, disadvantaged communities? And what kinds of maps are you going to draw? So because of the baseline work that we did with the environmental justice screening method, because CalEPA was required to figure out and develop a very transparent strategy for identifying those disadvantaged communities for the investments of cap and trade funds, we were able to help them integrate that into what is now called CalEnviroscreen. So for those of you who don't know it, you should go and check it out. And they went through a very similar kind of open process to develop their tool, but we had a lot of data. We were able to give them the data and the methods for how to score. So we basically were able to provide them the foundation for how to do this. They made some slightly different decisions ultimately on how to score things, but this is now what is used to help identify disadvantaged communities for investments of these funds. You can go online and actually look at what kinds of programs these things are where this money is going. There's a fair amount of engagement. It's a pretty transparent process. Not always harmonious, but pretty transparent. So I just want to end by saying that using these large administrative data sets, I think, enables you to answer kind of big picture questions about the connections between equity and environmental quality that you might not be able to answer as well with primary data collection activities. And if you can engage community partners, particularly people who are disproportionately impacted by the environmental hazards that you're worried about, it can promote what I like to call the three R's. So rigor, relevance, and reach in terms of how we do our projects. So what I mean by rigor is that community involvement in these data projects can promote, I think, good science and sort of giving you feedback on your research design, giving you information about what's going on the ground, and maybe good explanations about the disconnection between what your data might be saying and what you're actually observing on the ground when you're looking at your results. And also maybe how to interpret your results and how to make your data collection and future administrative data sets better, which that sort of community input has helped administrative agencies like CalEPA, the Office of Environmental Health Hazard Assessments, improve iterations of the data sources that they make public that many of us analyze. Second one is relevance. When you're collaborating with communities on your data projects and always getting those feedbacks, you're kind of being forced as a scientist to always make sure you're kind of asking the right questions, particularly if you're doing these projects to inform decision-making and environmental policy. And in this case, environmental justice advocates really want to make sure that the questions that you're asking and seeking to answer really get at the structural causes of racial and class disparities in exposures to environmental hazards and elucidate opportunities for what can be done either collectively or individually to protect public health. And finally, when you collaborate with communities in the development of these projects, they become vested in them. They disseminate that knowledge. They can leverage them in ways that geeks like me can't necessarily do in Sacramento because they are the faces of a lot of the statistical work that can really kind of move policy change in ways that scientists alone can't ever do. Those partnerships, I think, are really essential for advancing policy. And the other thing is they become vested in the policies that emanate from it and from the tool itself. So, for example, in California, we had an initiative several years ago that tried to overturn our climate change law during the Great Recession, okay? And everybody was pretty nervous that AB 32 was going to be stopped in its tracks. But because there had been such an engaged process And again, not harmonious, very contentious, but a lot of policies had been developed to make sure that these funds were going to be more equitably distributed. Now people were vested in that policy, making sure that the baby wasn't thrown out with the bathwater. And a lot of what really pushed back that effort to overturn California's cap-and-trade law was the understanding and engagement of environmental justice advocates in the creation of the law and the development of the tools to implement it. So I'm going to end there, and I thank you for your attention, and I look forward to your questions. Thank you.